the transport of fresh, breathed-in air towards the lungs of human beings with a chronic obstructive bronchopneumopathy, such as asthma, is rendered difficult due to bronchoconstrictions and other factors. Such patients need respiratory support to allow the oxygen to be transported through the proximal bronchial tree and then diffused in the distal one. One such support system consists of the inhalation of a mixture of Heliox that consists of 20% oxygen and 80% helium, usually delivered in cylinders. This facilitates the transport of oxygen and exhalation of CO2. The modeling of the transport of oxygen, helium, nitrogen mixtures between the Heliox cylinder and the patient requires the use of the Maxwell-Stefan diffusion equations. For theoretical background, consult my paper published in Chemical Engineering Science in 2019. Watch also other YouTube videos on my channel titled Uphill Diffusion, Diffusion in Gaseous Mixtures. Heliox therapy is applied to patients who have severe breathing difficulties. In that case, the patient is connected to a Heliox cylinder, and typically a Heliox cylinder has the composition 80% helium, 20% oxygen. Let's assume that the lungs of the patient is a 80-20 mixture of nitrogen and oxygen. Note that the oxygen mole fractions in the cylinder and within the lungs of the patient is precisely the same, that is 0.2 mole fraction. There's no driving force for transfer of oxygen, but due to the coupled diffusion effects, we have uphill transport of oxygen, and the trajectory followed by the compositions in the cylinder and in the patient are plotted here, and the trajectory that's calculated using the Maxwell-Stefan equations show a serpentine character.